and purple is the mixed blood. So daripada placenta, it goes through the ductus, through the umbilical vein, through the ductus venosus. Kat sini je ductus venosus, masuk into the inferior vena cava, masuk through the right atrium. Daripada right atrium, majority will bypass, goes into the left atrium. Some will go into the right ventricle. The right ventricle masuk ke pulmonary artery. Dari pulmonary artery dia bypass through the ductus arteriosus, masuk dalam aorta. Dan dia pusing. Dekat iliac artery, dia akan bercabang jadi umbilical arteries, masuk balik to the placenta. Okay, so again, placenta as the organ of respiration in the fetus. Okay, and the function of the arteriosus and foramen ovale, as I have shown before. So, vessels constricted because of the fluid causing pressure, and also because of the low oxygen concentration. This is the ductus arteriosus. So all this happen, umbilical cord clamping, umbilical cord clamping, the uterine contraction, and so on and so forth. These are the changes that happen. It stimulates the cardiorespiratory center, and then mechanical compression. Mechanical compression. Fluids will go into the interstitium and drain through the lymphatics. And then it's not just about clearing up the fluid, it's also about maintaining the surface tension. How to maintain the surface tension? It means the surfactant. Surfactant ni macam kita main buih kan. Bila air tu kita letak sabun. Sabun is used to be used to be made using surfactant. Sabun during old times, 1800, 1800 dulu kan, sabun used to be made, the process saponification used to be made using surfactant, animal surfactant. So surfactant creates surface tension. Bila you maintain surface tension, you boleh maintain the integrity of the bubble. Kan? Without maintaining the integrity of the bubble, without maintaining the surface tension, the bubble will pop and collapse. Sama juga dengan airway kita. Kalau kita don't have enough surfactant, the airway will collapse. Alveolar will collapse. It needs surfactant to maintain the surface tension. So if the baby is being born early, the baby will not have enough surfactant. Bila do not have enough surfactant, the baby will have respiratory distress syndrome, RDS, or hyaline membrane disease. Sebab you akan nampak hyaline changes. Because apa? Because airway dia collapse. Airway dia collapse. Ada some other things that are opposite that causes surfactant dysfunction. Contohnya macam apa? Contohnya macam infant of diabetic mother. Diabetic mother, there's a high risk of surfactant dysfunction sebab reduces surfactant production and so on so forth. So infant of diabetic mother walaupun term pun boleh jadi RDS sebab surfactant. Sama juga dengan with meconium aspiration syndrome. Babies who have meconium stain amniotic fluid, baby yang dah dia dah poo past meconium before being born, amniotic fluid dia is filled with meconium. Meconium tu dia boleh swallow, meconium masuk dalam lungs, meconium counteracts the action of the surfactant. So in meconium aspiration syndrome, in meconium stain amniotic fluid babies, they can also have respiratory distress syndrome. Sebab apa? Sebab meconium acts against the surfactant. Okay, so after birth, the lungs are now the primary organs of respiration. So increased oxygen causes pulmonary vasodilation, and it causes the closure of the ductus arteriosus. And this is the normal neonatal circulation. So these are the changes that I have mentioned before. I hope you remember and understand. Okay, clear tak so far pasal cardiovascular changes ni? Clear?
Clear.
Okay, next we go to other changes. Thermoregulatory changes. So in utero, baby is in a very optimal environment, optimal temperature. Ni yang Allah sebut fi qararin makin. In a secure place. It's a sterile, it's a safe, optimal temperature. Semua temperature maintained by the mother. And mother being an adult is able to maintain thermoregulation. But in fetus, so thermoregulation kita, the center is in our hypothalamus. Hypothalamus is our thermoregulatory center. So in babies, the thermoregulatory center are not mature enough. So dia tak boleh maintain dia punya thermoregulation. Right? So in utero, environment temperature is maintained by the mother. So bila baby is being born, dia kena maintain dia punya own thermoregulation. Macam mana dia nak maintain dia punya own thermoregulation? Yang pertamanya dia ada brown fat. So brown fat is a very good medium for thermoregulation. So kalau babies tu yang born premature, they don't have enough brown fat. So brown fat, bila brown fat is metabolized, bila brown fat metabolized, it produces a lot of energy and a lot of heat. So it's a very good medium for heat generation. Metabolism of brown fat. So the more premature the baby, the less brown fat they have. Bila they have less brown fat, when they have less brown fat, they have less source for energy generation. They have less source for thermoregulation, heat generation as well. Brown fat. So baby kena boleh maintain. Macam mana baby boleh hilang dia punya temperature? So kita ada 4 mechanism of heat. So the energy is in the form of heat. Cold is not energy. There's nothing. Cold is nothing. Cold is not energy. Energy is heat. Cold just means lack of energy, lack of heat. Lack of heat, cold. The energy form is heat. Heat is the energy. So heat can be transferred by 4 mechanisms. Number 1 is by conduction. Conduction is direct contact. Conduction is by direct contact. So bila ada 2 surfaces in direct contact, heat akan transfer from higher heat into lower heat. Logic kan, transfer daripada higher heat into lower heat. Heat transfer, direct heat transfer by conduction. Second is by convection. So convection ni macam kita buka kipas kan. So direct contact, flow of fluid, flow of air kan. This flow is by convection. Number 3 is by evaporation. By evaporation. Dalam skin kita kadang-kadang ada sweat, ada fluid. Fluid dekat kulit kita ni bila it transform from water into vapor. This transformation of water into vapor, it needs energy. And that energy ni dia absorb energy daripada body in terms of heat. Baru dia boleh evaporate. So this is a very effective mechanism of heat transfer by evaporation. Number 4 is by radiation. Kalau kita pasang lampu panas, LED by fluorescent lampu ke kan, so it transfers heat. Transfers heat. So there are the 4 mechanism. Okay, the thing is for the transfer to happen, it needs surface. Kena ada surface. So the more surface area, the more areas for heat transfer. The more surface area, the more surfaces for heat transfer. Okay, kita tengok body surface area. Siapa lagi tinggi body surface area? Adults ataupun adults susah sikit. Okay, siapa lagi banyak surface area? Okay lah, adults dengan baby. Siapa lagi banyak surface area? Adults ke baby? Baby. Ada kata adults, ada kata baby. So the answer is obviously adult lah. Adult has higher surface area. BSA, kalau kita kira BSA, adult sometimes 0.7, 0.8, sometimes 1 meter squared body surface area. Kan? Body surface area ada formula dia. Adult has higher body surface area as compared to newborn, compared to babies. But if you look at, okay, kita punya fluid dalam body kita, kita kena tengok, so our fluid in the body is berapa? 80 ml per kilo, 80 ml per kilo. That's amount of blood in our body, 80 ml per kilo. Kan? Next, when you look at, you need to look at body surface area per weight, BSA per weight ratio. If you, kalau kita tengok BSA saja, obviously body surface area in adult is higher daripada in children. But if you look at, Allah, if you look at BSA per weight ratio, BSA per kilo ratio, BSA per kilo ratio, in the smaller the child, the higher BSA per weight ratio as compared to adult. Faham tak? If you look at BSA per kilo, a baby who is 3 kilo has higher BSA per kilo ratio as compared to adults. Contohlah, an adult who is 80 kilo, adult 80 kilo, probably the BSA is around 1 meter square. A baby who is 3 kilo has probably 0.5, 0.6 meter square BSA. Kan? 0.6 bahagi 3 as compared dengan 1 bahagi 80. So obviously, a small baby has higher BSA per kilo ratio. Faham tak? So per kilo, if we look at per kilo, a baby has higher BSA per kilo. So that's why per kilo, they have more BSA for heat transfer as compared to adults. Faham tak? Faham So again, if you look at BSA, obviously children has lower BSA, but if you look at per kilo, BSA per kilo is higher in a small child. The smaller the baby, the higher the BSA per kilo. The more premature the baby, the higher the BSA per kilo the baby has. So this is the problem. So the smaller the baby, the more premature the baby, the more potential for heat loss in the baby. Sebab itu, the smaller the baby, lagi kita kena jaga. Sebab itu, in a term baby, baby keluar, kita wipe the baby, kita dry the baby. Sebab kita tak nak heat transfer by evaporation. Kita letak baby under radiant warmer, kan? Untuk bagi heat. Bagi control dia punya, reducekan the heat loss. Kita make sure kain yang, the linen yang we use to resuscitate the baby tu, ideally it should be a warm linen. Linen yang dah di-warmkan. Why? To reduce amount of heat transfer by conduction. Make sure tak pasang kipas kat tepi, so there's no heat loss by convection. We put radiant warmer, so reduce the heat transfer by radiation. And we dry the baby to reduce the heat loss by evaporation. So that's the idea. This is one thing I need to remind you all. Kalau in children kan, among the treatment yang kita biasa buat apa untuk bila baby ada fever, kita biasa buat tepid sponging. Tepid sponging. So tepid sponging ni is good lah. Kalau you tengok cerita P. Ramlee kan, tepid sponging dia buat macam mana? Dia pakai ais, dia letak dekat dahi kan. And some people in the ward pun dia ambil cold water, dia people pakai ais lagi kan. Dia warm, dia sejukkan the cloth ni, and dia letak cloth tu dekat dia punya forehead, dia letak cloth dekat dia punya axilla. The thing is, when you do that, when you put cold punya material, cold surface, you letak dekat forehead, you letak dekat dia punya axilla. Mula-mula, obviously akan ada heat transfer by conduction. But what will happen next? Several things will happen next. Nombor satu, it's the same thing lah dengan some parents kan. Bila anak dia dapat febrile seizure, fever high, tengah-tengah high tu, dia ambil anak tu, dia letak, dia mandikan dengan air cold water. Kan? First, there will be heat transfer by conduction. Sebab direct contact, kan, heat transfer by conduction. What will happen next? Nombor satu, the cool cloth tadi tu, dia akan start to warm up. Bila dia start to warm up, there'll be no more heat transfer by conduction. Nombor satu. Nombor dua, bila you introduce cool things to your skin, what will happen to the surface, to the superficial vessel? What will happen? The vessels will vasoconstrict. The vessels will vasoconstrict. Bila superficial vessels ni vasoconstrict, what will happen? Heat, internal heat daripada body, internal heat, dia tak boleh nak keluar. Why? Because the surface punya vessels are vasoconstricted. Sebab itu, it's not ideal. So how I would suggest to do proper tepid sponging is, kita guna lukewarm water. Tepid punya water, lukewarm water, air suhu bilik. Kan? Kita warmkan, kita make sure dia punya cloth tu is a bit damp sahaja, dan kita dabkan on the skin, whole body. Bila ada droplets of water on the skin, first there'll be heat transfer by conduction, nombor satu. Nombor dua, kita nak these droplets of water on the skin, it evaporates. Kita nak heat loss from evaporation, that is more effective. Sebab it doesn't cause superficial vasoconstriction, so internal heat boleh continue to keluar. Kan? Internal heat boleh terus keluar. And heat transfer by evaporation. Kalau kita buat bagi benda sejuk, mula-mula conduction, but internal heat tak boleh nak keluar. Nombor satu. Nombor dua pula, kita boleh introduce shivering. Bila the child shiver, kan, movement, kinetic energy produce more heat in the sense of heat. And movement of muscles. If you remember your physiology, movement of muscle uses ATP and so on and so forth. The end product, one of the product is heat. It produces heat. So more internal heat is generated. Sebab itu kita tak nak, ideally kita tak nak introduce dengan benda sejuk. Macam tu. So this is how you go. Kita nak by evaporation. Sebab itu in newborn babies, kita letak under random warmer, kita letak on a warm linen, and kita dry the baby to reduce evaporation. Okay, clear so far? Next is homeostasis. Again, as mentioned before, number one is the brown fat. So brown fat is a very good medium for heat generation, brown fat. Number dua, if you remember, newborn in fetus, macam mana fetus tu dapat glucose? Fetus dapat glucose daripada mother. Fetus dapat glucose daripada mother. Let me try and draw. Okay, if you look at ini graph. Okay, bila mother makan, glucose level naik kan. Lepas tu kita ada level insulin. So bila mother makan, body detect insulin, pancreas akan produce insulin. Bila insulin produce, glucose akan mula turun. Dia akan ada this period of relative hypoglycemia sekejap, within 1 hour, lepas tu dia akan normalize balik. Ni masa period yang kita mengantuk ni. That's why within the first hour, after postprandial lah, after kita makan, dia ada relative hypoglycemia. Ni period yang kita mengantuk ni. If you can stay awake within this 1 hour, then you will survive. Sebab kita mengantuk 1 hour after feeding ni because of this relative hypoglycemia. So because of insulin level kan, insulin naik, then bila dah tu, insulin akan turun and maintain the level. So this is what happened. So the thing is, glucose from mother crosses placenta into the baby. Glucose from mother crosses placenta into the baby. But insulin from mother does not cross into placenta. So maknanya if you look at babies kan, baby bila mak makan, glucose dia naik. Kan? Tapi macam mana glucose nak turun kalau tak ada insulin? Insulin does not cross placenta. Insulin is a big molecule. So apa boleh buat? Baby kena produce own insulin. Baby punya pancreas kena produce insulin. Faham? The problem is newborn fetal punya pancreas only starts to produce insulin around 8 to 12 weeks period of gestation. So before 8 to 12 week period of gestation, pancreas in the baby does not produce insulin. So issue dia, and you need insulin untuk transfer of glucose daripada blood vessel nak masuk dalam sel. You need insulin. You need insulin. So problem dia, in the first 8 to 12 week, dia ada unopposed hyperglycemia. 8 to 12 week period of gestation, dia ada unopposed hyperglycemia. And this unopposed hyperglycemia is teratogenic. So this is why in infant of diabetic mothers, especially those yang tak tahu dia pregnant, sebab most ladies, most women dia tahu dia pregnant bila? 2 months kan, 2 bulan tak datang period baru dia cakap, oh pregnant rupanya. So 2 months is around 8 weeks. So before that, there is unopposed hyperglycemia. Bila unopposed hyperglycemia is teratogenic, that's why infant of diabetic mother at higher risk of developing things like sacral agenesis, spina bifida, AVSD, atrioventricular septal defect. And all these problems are a result of unopposed hyperglycemia, which is teratogenic. So around 8 to 12 weeks, baru baby boleh produce insulin. Baby produce insulin, insulin naik, glucose akan turun. Macam tu, around 8 to 12 weeks. If you can imagine, in a diabetic mother, glucose level dia tinggi, kan? Mother produce insulin, baru glucose level dia turun, kan? And mother ambil medication, mother ambil insulin, bla bla bla. The issue is, in an infant of diabetic mother, baby ni dah biasa dapat insulin, dah biasa dapat glucose level yang tinggi daripada mother. Sebab mother diabetic, baby biasa dapat glucose level yang tinggi daripada mother sebab mother dia diabetic, kan? And baby punya pancreas dah biasa produce high levels of insulin sebab dia dapat high levels of glucose daripada mother. Sekarang bila baby keluar, kan, baby dapat gula daripada mana? Baby dapat glucose daripada breast milk. And the volume of breast milk baby dapat, especially the first day of life, 60 ml per kilo per day. The first day of life, minimal 60 ml saja. Usually it's not enough. So that is why infant of diabetic mother, dia ada risk untuk dapat hypoglycemia. Kenapa hypoglycemia? Sebab dia punya pancreas baby dah biasa produce high level of insulin. Yang ni kita panggil sebagai hyperinsulinism. Sebab baby dah biasa produce high levels of insulin. Sekarang tiba-tiba glucose yang dia dapat tu is less daripada apa yang dia dapat daripada in utero. So that's why baby is at higher risk of hypoglycemia. Sebab hyperinsulinism. Sebab apa hyperinsulinism? Sebab baby dah biasa produce high levels of insulin. Clear? Jelas? Faham ke tak faham? Faham kan? Okay. Next, fluid balance pun sama macam mana. So babies usually in utero dia dapat fluid semua daripada maintain amniotic fluid, lung fluid, everything is from the mother. But now baby needs to maintain dia punya own fluid balance well. And some baby was not able to do that. Liver function pun sama. In utero, liver is the main organ for hematology. So the main hematological punya organ is actually liver. Most fetal hemoglobin is actually produced by the liver. So the younger, the more premature the baby, the less all this function. Iron storage, carbohydrate metabolism, especially brown fat, and then glycogen storage, everything is in the liver. So now baby needs to use all resources yang dia ada, which is from the from the liver, coagulation of bilirubin. So the younger the baby, the less capability of the liver to function, less glycogen, so less carbohydrate metabolism, less coagulation, less production of coagulation factors. So dia boleh dapat coagulopathy of prematurity. They don't have the mature capability to conjugate bilirubin. So they may have higher levels of bilirubin, high levels of hyperbilirubinemia. The GI system pun sebelum ni dia dapat direct through the umbilicus, but now dia kena pandai nak swallow, dia kena pandai nak digest, dia kena pandai nak metabolize, dia kena pandai nak absorb all the fluid contents. Stomach dia baby, newborn baby, the stomach is very small. Mula-mula dia very small. At the first day of life, dia only boleh tolerate 60 ml per kilo per day. And dia punya muscle dia ada dua sphincter. Cardiac sphincter dekat atas, and you have the pyloric sphincter yang connect between stomach to the duodenum. There's the pyloric sphincter. The cardiac sphincter connects between the stomach to the esophagus. So dia punya cardiac sphincter dia is immature, it's not strong enough. Bila cardiac sphincter dia not strong enough, bila ada gastric contraction, kita dokong baby bla bla bla, so there can be regurgitation. There can be regurgitation. Sebab itu it's very important to burp babies untuk minimize risk of regurgitation, vomiting and so on so forth. And newborn babies, they must pass meconium within the first 24 hours. Kalau dia tak pass meconium, sometimes dia ada problem. Sama ada problem with the bowel obstruction and so on so forth. This pun sama. Probably everything is excreted through the umbilicus, but now baby kena function sendiri, baby kena able to metabolize, able to clear up, kena excrete all the toxin and so on and so forth. So that is why, especially the first week of life, the first day of life, all baby has oliguria. All babies has oliguria for the first 24 hours of life. Lepas tu baru dia akan start produce more urine. That is why drug doses pun will be different. Drug doses for premature baby is different as compared to drug yang excreted by the kidney. Drug yang excreted by the kidney, dose dia different. Contohnya macam gentamicin, amikacin, antibiotik. So certain drug yang metabolize dekat liver, you kena tengok liver function. So drug doses will be different. Paracetamol, morphine, phenobarbital, all these are metabolized in the liver. Drug yang excreted through the kidney, gentamicin, amikacin, so all these have a vancomycin. So these are all medication yang drug doses dia kena differ untuk newborn babies. Sebab kita kena appreciate yang babies has lower GFR. Bila lower GFR, half-life of those medication is higher, and certain medication can cause nephrotoxicity. Alright, I think that's all lah. Immune system pun sama, immune system slowly baby depends on the mother. Immune system daripada mother ni by few mechanism. Yang pertamanya is antibody transfer, IgG transfer from the mother to the baby. And this happens around 22 to 24 week period of gestation. Before that, there's not much antibody transfer from the mother to the baby. So, bila the baby is being born early, less IgG transfer from the mother to the baby. IgM is a bigger molecule, generally do not cross into the placenta, into the baby, but some IgM does cross placenta into the baby. Macam dengue IgM, varicella IgM do cross placenta into the baby. Generally, IgG is the one that crosses the placenta from the mother into the baby. That is why we encourage mothers to get vaccination masa pregnant. Sebab kita nak more IgG transfer. Tu masa in utero. Kalau baby born early, not enough IgG to protect the baby. Number two, baby can also get immune system adaptation by apa? By breast milk. Because studies have shown dalam breast milk ada IgA, secretory IgA. Contohnya macam COVID, for example. If a mother has COVID, COVID does not transfer from the mother into the baby by breast milk. but COVID IgA crosses from the mother into the baby by breast milk. So you want to protect your baby, breastfeeding. Studies have shown bila baby is unwell, mother punya breast milk automatically will have higher IgA, will have higher white cell to protect the baby. So that's how the baby gets immune protection. These are the barriers, and maternal punya vagina kan, it has certain common cells, common organism. These organisms are very important. So because there's a lot of study now suggesting the importance of probiotics, normal gut flora, normal gut microbiota. So for a healthy immune system, you need all these normal gut punya organism. Normal gut organism, lactobacillus, bifidobacteria. You need this to help you to have better immune system. So some studies have shown babies who are born by cesarean section, but they tak go through the normal birth canal tu, dia tak dapat contact with the normal common cell. Babies are born by cesarean section, they don't have enough normal gut flora. So immune system is lower. Number 2, babies who are born and admitted. Bila baby tu admitted to an ICU, also they are not introduced to the normal environment, normal flora. Bila dia tak ada normal flora tu, dia ada apa? Dia dapat mungkin the NICU punya flora, which is more problematic. So when they don't have enough normal gut flora, the immune system is weaker as compared. So some studies have shown, contohnya kan, kenapa sekarang ni post-pandemic ni, we have children who are immune system dia not as strong as previously. Among the suggestion is because of the 2 years MCO ni, PKP yang extended in Malaysia especially. That's why our children are not as strong as before. Okay, alright. I think that's it lah. That's it. The most important element from the lecture is actually understanding the cardiorespiratory changes. So that's the single most important, the most important element of this lecture. Okay, clear? Ada soalan? Ada soalan? Ada? Tak ada? Clear?
Clear.
Clear. Alright. So I think if you understand that, then we can proceed later lah. We'll proceed with the 2 lectures because the other 2 lecture, birth asphyxia and also prematurity and its problem, you can only understand those if you understand this adaptation from in utero to extrauterine life. Okay, alright. I think if there's no question, let's end here. Let's end with tasbih kafarah in Surah Al-Asr. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Doctor.
Waalaikumsalam. Thank you, Doctor.